Well, I want to thank everybody for joining with us here today, and I particularly want to thank McAllen Mayor Darling, as well as Hidalgo County Judge Cortez, and my peers at the state level, Chief Niemkid, the Chief of the Texas Division of Emergency Management, and Judge Norris, the Adjutant General for the Texas National Guard. I'm here today to make several points. First and foremost is to emphasize that as we continue to respond to the challenge of COVID, we have one priority that is our top priority, and that is ensuring that we provide vaccinations for our seniors. And there's a reason for that. Mathematically, it's a fact that seniors who contract COVID are the people who are most likely to either be hospitalized or lose their life because of COVID. And we have seen, because of the rollout of vaccines and because of the significant number of seniors who have already received a COVID vaccine, that has led to an ongoing downtrend in the number of people who are hospitalized, as well as the positivity rate in the state of Texas. So these vaccines are working, but the fact is there are more seniors who still have yet to receive a COVID vaccine. So what we want to do today is tell you what we are doing specifically in Hidalgo County and the Rio Grande Valley to make sure that more seniors will be able to get access to a COVID vaccine. Last month, we launched a program called Save Our Seniors. It's a program to ensure that homebound seniors will be able to get access to COVID vaccines. This effort has been spearheaded by the Texas Division of Emergency Management, as well as the Texas National Guard, working in collaboration with local partners. We begin this program in rural parts of Texas, so sparsely populated areas, as we work to both perfect the program, but also work to get to places that simply were not getting any access to COVID shots whatsoever. So far, 90 counties have participated in the program to vaccinate homebound seniors. Now, the Save Our Seniors program is reaching more populated counties like Hidalgo. I want to thank Judge Cortez and Mayor Darling and the McAllen Fire Department, as well as the offices of emergency management in McAllen, Alamo, Pharr, and San Juan for their partnership to help vaccinate homebound seniors in the Hidalgo County area. Also, in addition to that, we are announcing today an expansion of the Save Our Seniors project. In addition to the teams that will be going around identifying and locating seniors who are homebound and providing them a vaccine, we have an outreach program. It's a combination effort by the state of Texas, the Texas Health and Human Services Commission, as well as local entities. Let me give you some examples. We're working with Medicare health plans, including United Healthcare, Humana, Blue Cross Blue Shield of Texas. And the partnership also includes working with the Texas Employee Retirement System, the Teachers Retirement System, AARP, which together will help us identify seniors age 50 and older who we can reach out to make sure that they are capable of getting a vaccine. Altogether, this will continue to expand the number of people who are most likely to be hospitalized from COVID to be able to get a vaccine, get it quickly, to make sure they stay healthy. Because of successes like the Save Our Senior program, and with the increased vaccine supply that we continue to get on a weekly basis, we are now going to begin expanding vaccine eligibility to all adult Texans beginning this coming Monday, March the 29th. In just a few days from now, Texas will have so many vaccinations that we will surpass 10 million vaccine shots administered in Texas. And with more vaccines on the way and more Texans eligible, we are working to ensure that every Texan who wants a vaccine shot will be able to get one. Now, some Texans are still uncertain about how they can find out how to go about getting a vaccine or where to go to get the vaccine. And we're making it very simple. Anybody who wants a vaccine shot, all that you need to do is to dial 211. It's very simple. Call 211. You will be asked for a prompt to press a number on there on your phone to connect with the COVID response, and you'll talk to an operator who will tell you the location nearest to where your zip code is where you can get a vaccine shot. Now, even though I've told you right now that we're opening up access to vaccine shots to every adult in the state of Texas, I want to double back and reemphasize that our key focus remains on making sure that seniors will be able to gain access to those vaccine shots. So I want seniors to understand that even though more people will have access to it, seniors will still have the ability to go to the front of the line. So for the time being, anybody who is 80 years of age and older, you will get to go to the front of any line providing vaccines in any part of the state of Texas. All you need is an identification card showing that you in fact are 80 years of age or older. And you don't even have to make an appointment. Go to any location that's providing vaccine shots and you will be able to go to the front of the line to get your vaccination. That's how important it is to make sure that we get everybody who's age 60 and older a vaccine shot. Again, I want to thank our partners today, the City of McAllen and the County of Hidalgo, as well as partners like that we have throughout the entire state of Texas for working with us to achieve our common goal, and that is to reduce hospitalizations and fatalities from COVID by working to provide more vaccinations to more seniors across the entire state of Texas. Next, I'm going to pass it over to the Chief of the Texas Division of Emergency Management, Nim Kidd.
Thank you, Governor, and I want to take a moment to thank you for the clear direction you have always given us as it relates to COVID-19 and the disasters that we've worked together. Taking care of our seniors is our #1 priority because they are the ones that are most vulnerable. They're the ones that were most at risk of being hospitalized and death. And we've worked very hard to do that. The teams at the local level have been phenomenal. The state agencies in response to this, not just our division, but the Texas Military Department, the Texas Forest Service, AgriLife, Engineering Extension Service, the Department of Public Safety, all of the state agencies working together at your direction to focus on this task. I'm happy to say we're going on a second round of some of our nursing homes right now because in the early days there was a little bit of hesitation by some people that didn't want the vaccine. Health and Human Services Commission has contacted all of their facilities. 881 of these facilities say that they have about 24,000 people that now want the vaccine or that maybe have moved in after we started doing this. Our focus is laser on them, Governor. It's to go and get those vaccines in the arms as fast as possible. And I couldn't leave here without thanking one of my very dear friends, Director Eddie Olivares from the Hidalgo County Public Health Department. Eddie's been a tireless champion of this. He's a friend of mine. He's a mentor to me. And I want to thank the mayor and the judge for supporting him through this process, Governor.
Thank you very much. And next, a key partner in all of this is the Texas National Guard. And we have with us the Adjutant General, Tracy Norris.
Thank you, sir. First of all, I'd like to say that we have over 2,800 soldiers and airmen currently in our COVID-19 mission. Behind me, I have Major General Tom Seltzer. He is the dual status commander for our COVID-19 response in support of Department of Emergency Management. And what that means is he also commands the 508 active duty soldiers or Navy that are here helping with the vaccine in 3 different places. Currently, we are also still working the resource areas where we're storing PPE for the hospitals. We're also still in the food banks for the COVID-19 response. And also, very quickly, as the governor expands this program for the seniors, we'll also be expanding our forces in support of what's needed at the local communities. One other thing I'd like to do, I'd like to reach out and really thank the employers of our National Guard soldiers and airmen as they're on this mission. They've been on this mission since March of 2020, as well as all the others in the other agencies. And also I want to thank their families for the support they're getting, because a lot of us that are on the response have been staying away from home for a while. And again, just lastly, I'd like to say, sir, that we're Texans serving Texas.
Great. Thank you, General. Let me just close with this point. One thing that we have begun to observe is a decrease in demand for COVID shots. And I can't put my finger on exactly why that may be, but let me address a couple of issues. There could be some hesitancy by some people to get a shot, or there could be some level of frustration that there were people who were trying to get a shot and they could not get in line. We are working to address both of those issues by opening up more sites, as well as by going directly to where people live. We're trying to make it easier than ever before to make sure that you will be able to get your shot. If you are one of our seniors, you will be able to go to the front of the line without having to worry about getting logged into some website or anything like that. At the same time, it's so important for anybody who may have any level of hesitancy for them to know that the one medical treatment that you can get to make sure that you reduce the chances of you getting COVID and you maintain your health is to get your COVID shot. It's those COVID shots that are leading to the good results we're seeing in Texas. We will continue those good results if everyone will get in line and get your COVID shot.